Hey, Mo,
Hey, Ricky.
we're live.
It's true. And the doctor is in.
The doctor is in. The doctor is in.
Yes, yeah, and we're glad to be here today. If you're just joining us, you're just starting with us. We're talking about the state of Black health, and it is a great hump day conversation because we need to look at the barriers and the reasons why our community is why we're on the hump and how to get over the hump.
Right.
So we're going to be busting it up and talking today with the most amazing guest. And, we already started chatting behind the scenes, but I want you to introduce yourself. Tell us tell us your story and how you and Ricky came to be and tell us about the work that you're doing.
And she's a breastie, so she's extra special.
So yeah, I'm Rhonda Smith. I'm a 12-year breast cancer survivor. Actually, 14 years. Time, I
take those years, girl. Take all of those years. Every
like
minute counts.
Time warp. Yeah. So 14 years this May since my diagnosis, and as I was kind of talking about earlier, it was because of my diagnosis that set me on the path to do work in health disparities. And so I mentioned earlier, when I was diagnosed, I was fortunate enough to work. That was 2008. I was fortunate enough to work with a doctor of integrative medicine and an integrative nutritionist, in addition to my conventional care team. And I believe that made all the difference in the world in terms of me being able to stay strong and healthy and keep a strong immune system, as I was going through, especially chemotherapy and radiation. And, I also exercised every day. I was also blessed to live in South Beach, and was about a 10-minute walk away from the beach. So every morning I went for a 3-mile walk on the beach while I was going through treatment, which really helped my energy levels.
Oh gosh, yeah. You can see God on the beach every day.
Yes, exactly. Every morning I watched the sunrise over the ocean, which was the most amazing thing ever. And so it was because of my breast cancer journey that I started to do work in health disparities. So I mentioned, it was 2008 and I was self-employed as a consultant, and after my diagnosis was really contemplating my life and what I wanted to do next and what that would look like, and really knew that I wanted to focus on doing work that I was passionate about, that was an extension of how I live my life every day and not seem so much like work. And I was being asked at the time to talk to women who were going through their breast cancer journey, whether they were recently diagnosed or going through treatment or recovering from that, because people witnessed how I approach things and how I live my life, as a result of my breast cancer diagnosis, and definitely going through the whole treatment process. So I realized that was something that I really enjoyed doing, being a partner to women and supporting them throughout their journey. And so eventually I reformulated the focus of my consulting work and started a company called Breast Cancer Partner, which really initially focused on the phase they call survivorship, right, which is post-treatment. But I believe survivorship starts at the moment of your diagnosis. And
definitely the first minute.
Not waiting until you're done with treatment.
Right.
That's what I tell my patients. Survivorship starts day one. The minute you walk into that office. Yep.
Yep, for sure. So yes, we're all in sync about that. And so I really wanted to, from my own personal experience, really help women understand how to recover from treatment, restore their lives back to normal after treatment, and then live their lives well beyond their breast cancer experience. And so I started doing curated health and wellness events with the theme of recover, restore, re-energize. And
I love that. Recover, restore,
re-energize. And so I did some things.
That sounds like a great thing for the farm, Mo.
Yeah. I actually started a Facebook page, and I had a show on a digital platform back then. And so I, really started doing these events. And so it was all recover, restore, re-energize your sexual health and wellness. Did one of those, did that right before Valentine's Day one year. Did one for recover, restore, re-energize your financial health and wellness, because we know even if we have insurance, sometimes it still could be a hit. So I did one on prevention. Really, it was called Control the Controllable, and it was specifically focused on Black women.
Love it.
Because at the times when I was doing some research, I came across, this is back in probably 2009, 2010, I think. There was research that was recently published that talked about the connection between obesity and breast cancer risk. And I'd also come across some information on the Minority Health website that said, 3 out of 4 Black women are obese or overweight. So I had to look at that, like, I don't know how many times before.
Gosh, yeah.
Like that sunk in, right? And so I did.
We get very offended by those numbers, by that
I know.
classification, but it is a reality. I think when you look at the state of Black health, right? Like, we're going to segue into what the state of Black health is, and obesity is a huge factor, not just from the diagnostic number standpoint, but for what it means for our lives and our longevity, our survival.
Right. It puts us at risk for diabetes, heart disease, breast cancer, a number of things.
Stroke.
And,
Every kind of
stroke,
cancer,
like all of it.
All the things.
Between that and stress, right? I think stress is probably the number 1 killer.
Talk about that.
Yeah, don't even get me started on that one yet.
So how did you manage that during your journey? Did you have a support network around you, and how were you able to conceptualize and to balance, I guess, the stress of being a busy professional and moving and shaking and, being a consultant and all those things with this diagnosis? Yeah,
well, I actually took some time off from work. And my mom was alive at the time, so she came to stay with me. She was with me for about 3 months, and I was fortunate enough to have a team of friends who, came and brought me food, who took care of me, took me to appointments. So I had a village that helped take care of me. Beautiful. And I was very blessed. So, and I've seen women or met women who have chosen to keep their cancer diagnosis silent and to themselves. I have no idea why, but everybody approaches this in their own way that works for them. But I just know that going through something like that is stressful enough. But to do it without the support and love and care from people who you love and care about, and they love and care about you, is really tough. And so, and also I think generally I say you can either choose to be a victim or you can choose to be victorious when it comes to something like that, right?
Right.
And
that's right.
I noticed that women who kind of chose the victim role generally had more issues and challenges as they went through their breast cancer journey. So attitude is very important. And Dr. Mo, you may know the term psychoneuroimmunology.
That's right? It. Come on.
Yep. So the whole mind over matter thing is very important.
We love that.
So,
we love that word.
Yeah. So we know that if we're not mentally or, well, it can affect us in other ways. And if we're not physically well, so it's all interconnected. So the whole
mind, the body, and the spirit. You're right. They're all connected. Whether it's through whether it's causing cancer, whether it's through your treatment journey, how you do your outcomes, or how you just are able to rebound after the diagnosis and after the treatment, it is also so interconnected. And so that work sparked some advocacy work. And what was your experience in dealing with clients and getting women to reach out to you? How did that go for you? And were they willing to talk about their cancer, and were they seeking you out, or were there challenges there?
So usually it came through a referral or connection and introduction through a mutual friend. And then I just started to get involved in more breast cancer groups, or, I became a member of Gilda's Club in the cancer support community. And I think the biggest thing that made a difference was I actually started working as a consultant on a breast cancer research study at the cancer center where I was treated. And so there was a research study, an NCI-funded research study that focused on evaluating the impact of stress management and wellness education, specifically for the diverse population of Black women in South Florida. There's a small percentage of African Americans, but very heavily populated with the Haitian community as well as the Caribbean community. And so I learned, that was my first experience with health disparities. In the beginning, it was really a survivorship study because we were looking at women who were within 1 year of completing treatment. And as I started to get more involved in, the intervention side of things, in the beginning, I was just doing the outreach and awareness to help recruit women and educate women about, breast health and the study. But once we reached our target goal, I started to facilitate some of the sessions. And so I got to be up close and personal with a lot of the women and hear their stories. And so that helped me get known in the community about my work, and also garner some trust, from the women that I was helping through this journey, but also educating at the same time. And
So
so,
great, so great.
yeah, so
Thank
that
you for
was,
that. Well, it's like I always say, the Breasty Club is not one you want to be in, but we have to bring the love to each other, it's like a love that you can't even describe.
right.
It's
So there are
right.
a lot of women, end up doing something or changing their lives or doing something more meaningful and purposeful after their diagnosis. And so a lot of the nonprofit organizations that we know about, started because of that.
Hello, right?
Yeah, exactly.
Right.
Yes, case in point, right?
Right.
Did you find there was a lot of mistrust and some issues with health literacy, misconceptions, myths surrounding cancer and treatment and all those things? What are some of the things that you observed in the community? Have they changed over time since that work began?
No, actually, I don't see that much of a difference. Like I was living in Miami at the time, and now I live in Los Angeles, and I work for an organization that covers the entire state. And so, no, I don't see any difference in the mistrust. I mean, and let's acknowledge that, yeah, there are atrocities that have happened throughout medical history and
Yeah.
our
It's
past.
earned. That's
Right.
right. It is
It's
earned
earned.
medical
It's earned
mistrust. Yeah.
mistrust.
Yes, but we all know those things don't happen anymore because a lot of it came out of because of the Henrietta Lacks story. And now we have informed consent and a lot of patient protections when it comes to clinical trial participation and medical research. So, but despite that, there's still a lot of mistrust, and sometimes rightly so. I mean, if you look at any of the research, you see that people, especially people of color and especially Black people, still experience racism when seeking healthcare. And so because of that experience, it does breed a lot of mistrust, but, there are things that we can do about that, right? We don't necessarily have to work with that provider. We have the right to choose another provider that we feel, who's going to really care for us, right? So we have the power to make that choice. We also, if there's a cancer diagnosis, we have the power to get a second or a even third opinion. And so those things are important. And there's even an organization out there called Second Opinion that actually
you
provides
told me
support.
that. I looked them up after you told me about them. It's pretty cool.
Great. It's a great resource.
Yep. So there are resources out there that, we do our best to bring greater attention and awareness to our community about, and to improve health literacy. We have a major initiative that we launched last year called Health for Life, and the number 4. And that is our major initiative to improve health literacy for Blacks across the state. And so we view health literacy, working on both sides of the patient-provider relationship. So we know that we want to do our part to create a more empowered community of Black folks across the state. And for us, that looks like somebody who knows how to have a conversation with their healthcare provider, no matter what type of provider they're dealing with. They know how to advocate for themselves and their loved ones when they're dealing with the healthcare system. They know how to navigate through the healthcare system. They know what their patient rights are. They know how to participate in the decision-making for their care. And they know that they really, at the end of the day, have that power and should own that power and that dynamic. And when you do, that changes everything, right? You're really in control of your health and well-being, and you're much more well-informed as an individual and as a patient, right? So, so participatory medicine is, I strongly believe in that, and patient-centered medicine, and for people to really be part of that decision-making process, which is what health literacy is all about.
It's so hard though, Ron, I've been on the road now for like 11 weeks, and there's so many things that we just don't know that we don't know. And so what you're doing is so awesome and commendable, because we do need to teach our community how to advocate for themselves for every disease, not just cancer, but just even for getting your blood pressure checked sometimes, and I think that I just feel like we're so way below the level we need to be in terms of knowledge and information. So I think anything we can impart on people is critical.
Yeah.
How do we do that better? I don't think we're enough of it.
Right. And we hope that through that, people will begin to be more proactive about their health and prevent things from happening, because we know most of their chronic diseases are preventable. But we, really have to do our part to help people understand how to go about doing that, especially people who may live in, I say, under-resourced communities.
That's right.
You know, so that may not have safe places to play or even walk, but you know, we want to do our part to help people understand how they can do things at home. They don't necessarily have to have a gym membership. I mean, I live in LA, so traffic is horrendous. So while you're sitting in traffic, you could take a minute to meditate, right?
Come on, talk
Rest
about that. It's
and
so
relax.
true.
So conscious breathing and conscious breath is, you know, a powerful tool that we take for granted, you know, every single second of every single day. You know, sitting and quiet sometimes for 5 or 10 minutes can really make a difference. We know through some of the work that I've done in the past that just doing yoga, right, can help decrease your blood pressure, right? And so there are simple things that people can do that don't cost money, don't require travel, but that you can do to engage in self-care. Sometimes as women, you know, learning how to say no and setting boundaries is also important to do as part of our self-care.
Complete sentence. I struggle with that every day. It's a hard concept for us, you know, super mom, helicopter mom, superhero people, you know.
And Black women, right?
Oh my gosh.
It's baked into who we are and how we think we need to move about the world. You know, that strong Black woman trope is more than a trope. For some of us, it's a badge of honor. It's a cape. It's something that, you know, we can even hide behind as busy working professionals. You know, we got too much to do to have time to be sick, to have time to do this chemo, to have time to take these appointments and do this preventive care. Because let's be honest, preventive care is not the easiest thing to do. If you're going to get a colonoscopy, somebody's got to take off work. You got to do that prep. You got to get there. It's more than just, you know, saying I'm going to be proactive about this, but there is a level of engagement and individual responsibility that's really tough for people sometimes.
Right. I mean, it's just like, you know, I've heard stories about from women, you know, when we talk about getting annual mammograms, right? That, oh, it hurts. Oh, it's going to, you know, getting the radiation is going to give me cancer. But I'm like, okay, so for 90 seconds out of your life, a year, you can save your life, right? And
Trust me, it doesn't hurt as much as cancer.
I was just going to say cancer hurts worse. I told somebody that earlier this week. Cancer hurts more than a mammogram. Let's do it.
Yeah, it sure does. And so I just had a colonoscopy about 3 weeks ago. No, it wasn't fun, but you know.
Those were great drugs though, man. I was a happy person after that thing. That was a happy place to be, man.
Yeah, I woke up and I'm like, well, when are you guys going to get started? And they said, oh, we're done. Like, I wish I could sleep like that every night, but I don't want to take the Michael Jackson route. So
but you know what I say, if you're going to be doing your colon cleanse, if you're going to be doing, you know, all the things that we do to try to get ourselves right, might as well take a look up there while we're at it, right? Go ahead and start the fitness revolution off and allow that preventive care, because we know that colonoscopies save lives. We find those polyps, we take them out, it prevents death when you meet the screening criteria, which is a different story altogether. But I want to talk about if you had to say what the state of Black health is, let's just say for California, how would you sum it up?
A lot of people.
So we're a big state. I'll just, you know, say.
What's your 4 tenets there? Yeah.
So I'll just say for Blacks in general across the US, unfortunately, we're at the top of every list, which is not a good list. You know, from maternal health and infant mortality to cancer, chronic diseases, even rare diseases like lupus and sickle cell, and end of life. So we look at what I call the entire life health equity life cycle from birth to death. And so, you know, in California, maternal health is just like the rest of the country. Maternal health is a major disparity. In fact, you probably know this, Dr. Mo, like I think it was last fall, there was research that came out that talked about maternal health disparities are worse than what we thought, right?
Worse than ever. Yep.
Yeah. And we know that. I think
boggles my mind every day.
Yeah. And same situation here in California, although we've had some legislation passed in the last couple of years that it actually benefits and helps to close the gap in maternal health disparities for all women of color. When we look at mental health, COVID, same thing. We're seeing an increase in the need for mental health resources, which we know that there's not like the supply, so to speak, to meet the demand. We've seen an increase in teenage suicide rate. You know, we know that even before COVID, between 2012 and 2019, the rate of Black teen suicide rate increased 45%. So that was before COVID.
In the state of California?
Well, in general, but we've seen an increase in the state of California too. I mean, even in my personal network, I know of people who've had children or grandchildren, like a 13-year-old who attempted suicide, fortunately was not successful. Just look at what happened to Regina King's son, Miss USA, where she was Miss North Carolina. And so, we are really trying to understand, like, why is this happening? We know COVID contributed to, exacerbating the mental health and well-being of Black youth and teens and, students in school. And so we actually did a session in July in recognition of Minority Mental Health Awareness Month, or to talk about and understand better and try to peel back the layers of the onion around the impact of intergenerational trauma on the mental health and well-being of Black youth. And, throwing in some things about how COVID has contributed to that too, and people's experience. So we're really trying to get at key health issues. In fact, we have what we call the Black Health Agenda, which we're now going through the second iteration of. And we are going to 10 counties across California to do a deep dive to understand, like, why are health disparities happening in each of the different counties. And so at the end of this process, we'll have a statewide strategy and plan to close the gap in health disparities, advance health equity, and improve life expectancy. Because in California, like the rest of the country, Black people live about 5.5 years less on average than the state, everybody else in the state. When you look at
5.5 years less, wow.
Yeah, and that was actually before COVID. So we know that nationally,
those
the
statistics
gap
are
is widened
blown.
by 2 to 3 years. In California, we believe it's 1 to 2. That data hasn't been published yet because there's a little bit of a lag with the research and data gathering. And so we, in fact, tomorrow we have our Black Health Agenda in Sacramento County. We started out in San Joaquin County and starting in the northern part of the state and working our way down to San Diego. So we are, as part of this process, also leaving with each individual county a mini version of the Black Health Agenda that is more germane to that county, and engaging the community around this process so that they take ownership of what comes out of the process and things actually get implemented instead of creating a nice document that collects dust by sitting on the shelf. So we're really trying to activate the community because we believe it's about us and it has to be for us and by us if we're really going to solve this problem. So we can't wait, for other people to rescue us and or save us. We have to really do it ourselves. And so we're also going to be teaching folks and educating folks about how do you engage in policy, and advocacy, so that we've got enough programs and we can have programs out the wazoo, but programs come and go. But if you really want to create lasting change and affect some change and address social determinants of health and those factors that contribute to, health disparities in certain communities, we need to engage in changing policies, Because we know that policies will dictate the amount of investment or disinvestment that happens in certain communities. We know that that decision can, create social determinants of health or lack of resources when it comes to being a medical desert or a food desert or violence or poor air quality and water quality, all those things. But we know that if we participate in the process and we choose people who are going to represent our best interests in the best way, and we voice our opinion and amplify that voice in terms of what we need and what we want in our communities, we can make a difference. But we have to participate and I think go back to the way we were in the 60s as a people, really become more activists, Become activists and, because we can make a difference in our community and drive change that way.
I think we have forgotten how to truly be activists and that our voices have power, collectively. Everybody feels like it's somebody else's job, or I'm going to wait till I have enough social media following, enough this, enough that. And I think that's one of the things that we really need to impress upon people is that one individual, one voice, can make a difference, but nothing about us without us. Absolutely. That is
so true.
Yeah.
And what's an example of that? Remember when Dr. Gigi was on the show, Mo? We had this fabulous doctor from Georgetown.
Oh gosh,
and
yes.
She's a breastie, but she worked in kind of the AIDS epidemic and was on duty then. And she was talking specifically about clinical trials.
I know Dr. Gigi.
Dr. Gigi.
She started the Rodham Institute.
We love Dr. Gigi.
Exactly.
One of our,
She's phenomenal. But she gave us this example of how if you had AIDS, a clinical trial was your only choice for life. And
Yep.
so you didn't really have an option. You either take this test drug or you die, right? And how she had people lining up doing anything possible to get those drugs, and just the activism around AIDS and the support for those drugs and the support for getting care was so strong by the community.
Yep.
And
So yeah, so we hope
how
to
do we
start
do
a
that
Black
now?
health movement through our work in California. So we started a Black Health Network, kind of being true to our name. So, and you know, with COVID before I came on board, the organization was doing a lot of community convening events, bringing stakeholders together to do listening sessions and stay connected. But obviously we couldn't do that after COVID. So we created a virtual platform for people to come together, connect, communicate, collaborate, and do some networking no matter where they are across the state. And so we just, we're at about 250 members now. We started at 0. And we aim to have about 500 members in the network by the end of the year, and hopefully 5,000 5 years from now or more. But it's our way of really trying to build that collective impact and do power building across the state, so that, again, we can really leverage our unique competencies and capabilities and try to do this work collectively instead of in silos, right?
Yeah, that's the other issue, I think, are the silos. So talk about some of the collaborations and ways that you've been able to bring the organizations and bring different people together to support this mission.
Yeah, so we, before, you know, we were truly just grant funded, right? And I knew that if we were to grow and I was able to bring on more resources, we'd have to diversify revenue and find creative ways to support the organization. So we now have partnerships with corporations. So one example is Aarp. So we now have a partnership with Aarp, and we create curated health education events specifically for their members. There are 10% of their members across the state are, you know, African Americans. And so we work together to create health education events for their community as well as ours. And so
you work with the California office. Okay.
Yes.
Great. You know, we know them well. And Nick Lewis and Dionne Polite, she runs our Florida.
Down in Florida.
Yeah. So she's a bestie. Yeah. So
Okay.
that's a great idea, though.
Yeah.
Yeah.
And so we also have a partnership with California Life Sciences, which is like the Pharmaceutical Manufacturers Association, but all biotech and life science companies in California. So we're doing some events to educate the community about clinical trial participation. You participated in one of those, Ricky, back in June. Yep. And so from a community standpoint, we have other organizations that are like sister organizations of ours. They all are, you know, focusing on their specific race or ethnic population. So there's a Latino Coalition for a Healthy California. There's a California Pan-Ethnic Health Network and many others. And so we all play very well together in the sandbox, and we come together to collectively talk about how we, you know, as health equity leaders, really need to tackle issues that affect our community. Because really, at the macro level, we're all dealing with the same thing, whether it's AAPI, LGBTQ, tribal communities. At the, you know, macro level, it's all the same. You know, we recognize the nuances when you talk about cultural differences, right, for those communities, but when we talk about disparities, we really experience the same thing, right? True. And we strongly believe in collaborating and working together, especially to advocate for change and to support policies and legislation that really can improve access to care for our community. And for us, we're really looking at focusing on what we can do to affect legislation at the system level, because I suffer often from the Fannie Lou Hamer syndrome. Like, I'm sick and tired of being sick and tired of talking about disparities.
Yes, I'm being sick and tired.
Right.
Come on.
Right. And so until we get to the root cause of the problem, which we all know is racism and bias, like that we experience within the healthcare system and the structural barriers that are created because of that, until we start to make change there, I don't think we're going to, that's one of the key elements, right? And so in California, you know, 2 years ago, roughly, SB 464, or the perinatal equity bill, was passed, which requires providers in that space to go through implicit bias training, and then there's some accountability and metrics associated with that. But we know that that's not the silver bullet that's going to change things, but it's a start. And so if we can do our part to expand that legislation to more of medicine, and at least start to address that issue and then drive cultural change and have accountability around that, then that's something we're going to do. And we're looking at what we can do to create more anti-racist bills by even looking at what the curriculum is in medical schools, and how, by the time somebody is in a clinical setting, it's too late.
Yeah.
But if we can go further upstream and really address some of the issues like the algorithms that are used in making decisions about patient care. So those are the ways that we're looking at trying to dismantle some of that racism.
I love that, because now you're coming down my alley with the curriculum and working with medical students. I've done a lot of work in this space, really trying to influence the clinical curriculum, because it starts there, and the data shows that between the first and the second and fourth year of medical school, there is bias, and it's measurable, bias. And I think you answered my question. I was going to ask you about specific legislation that you'd like to see that you think can impact health equity, because that is another sort of gray area where people feel like, oh, I maybe don't have any influence. There isn't anything that I can do. How is legislation going to affect racism, attitudes in individual hearts and minds? But it has to do with the structure. Structural racism is by design, and you have to attack and dismantle the structure. So I think you really spoke to that. And how would that roll out? How would you see it rolling out in California?
So, well, I'll answer that in a minute. So we were also a sponsor. Unfortunately, was still trying to get that across the line, but we were one of the sponsors of, it's called the Health Equity and Racial Justice Fund. And we were asking initially for $300 million, and then it got whittled down to $100 million. But we didn't get, in the last round of the budget allocation from Governor Newsom, it didn't make it. But really the Health Equity and Racial Justice Fund was designed to provide funds directly to tribal communities and community-based organizations and community healthcare centers who are on the front lines doing this work to really help save lives. And we know a lot of times they are underfunded and under-resourced, right? And so instead of giving the money to, no disrespect, to public health departments and then having to rely on them to get the money to the community, we were really trying to empower communities and give them the resources that they need directly to do the work that they need to do and do capacity building so that they can continue and sustain that work. But we'll have to find other clever ways to get that passed. And so, we're looking at things like, I know at the federal level, there's the social determinants of health bill that's been kind of on the floor a few times, and seeing if we could do something like that in California, which really is very similar to what the Health Equity and Racial Justice Fund was intended or designed to do. And we're also working with, collaborating with the City of Hope around the Cancer Care Equity Act, which addresses the disparity that is part of the Medi-Cal system, which is our version of Medicaid. And so we know when it comes to cancer outcomes, Medi-Cal recipients fare far worse than people with private or employer-based insurance. And so we're one of the co-sponsors of that bill. So we hope that that eventually gets passed and signed. And so those are the kinds of things that we're doing to address. And so for the Cancer Care Equity Act, it would allow Medi-Cal patients, especially with a serious cancer diagnosis, to be treated at one of our accredited and NCI designated cancer centers here in California and get enrolled in clinical trials should they need to. And doctors would be required to inform patients about this. And so, those are the kinds of things that we're doing to really address and dismantle some of those barriers.
Wow. What do the other states do? Like, they need one of you in every state, Rhonda. Like what's going on across the world. So, I think what you're doing is miraculous, right? In terms of all the things that you're touching, right? But I have just a couple questions that came to my mind as you were talking. Sure. And I'm going back to the mental health conversation, because I think so much of disease starts there with stress and with not handling our emotions, you know, not being able to take care of ourselves emotionally. Do you think there's still a stigma about it? with
I
Black
was
people.
just thinking, yeah, right. There still is, you know, I think it's a generational thing because what I'm hearing is that
Yeah,
I guess
yeah.
the Generation Z individuals are more open and receptive to seeking mental health care. Probably my contemporaries, not as much, but doing that a little bit more than what we've seen historically. But yes, and I think, you know, there's also the lack of access, right? And so we know that now there's 988, which is like an emergency number for people to call with mental health distress, but I'm convinced that our community is not going to do that. So 988 was created as, intended as an alternative to calling 911 and the police showing up when there's an acute mental health situation. But we know if it's acute or a mental health issue in our community, we're not going to call somebody, right? So, we're hoping that, we can, do something to help support training community healthcare workers and community advocates to be mental health resources within communities, because they're already trusted resources, right? And are already probably doing that anyway, especially if you're talking about people in the church or faith-based community and some other community-based organizations. So if we can have the resources to train community healthcare workers to also be a mental health support and resource. Not everyone has to go to medical school, right? Or graduate school to get, to do that. And so
to do this work, say that.
But we're doing, that would be economic development, right? So we're giving people career options or new side hustles, so to speak, but we're also providing accessibility for people at the community level who need access to those resources from someone who looks like them that they trust.
I trust. You're
So providing culturally competent care. So.
Yeah, you're so right on the age thing too, because even my daughters, I guess Haley's on the bottom of millennials. They use the word anxiety like water, like my anxiety is bothering me today, or like, or my anxiety is really flaring up. Like I didn't even have a concept for that word when I was their age, right?
Yeah.
We think about like just to use the use of the word anxiety. I don't even remember ever using that word till my kids were right. I mean, like we didn't. You just you got to do the stuff. What are you gonna do? Not feed the kid, not go to work. What are you gonna do? Do what you got to do, right?
Yeah.
Right.
Yeah.
Wow.
So but there's a, I said this to someone because I was at a conference and it was a panel on mental health, and I think it happened. I can't remember. There's so many, unfortunately, which shooting it was right after, and then I asked a question about like why are we seeing an increase of violence from young white males, like teenagers? Like why is that happening? And I think that's a question that needs to be explored a bit, because there's something going on there. Because when you look at, who's been doing these massive shootings, right? Kind of a similar profile as young white males, late teens or early 20s. Why is that happening? I don't have an answer, but I would like to, understand better.
Well, and I guess the question is, how should the focus be on that, and how can that help further the cause for health equity without recentering people who have already been at the center of everything?
And entitled, yes. So yes, I mean? I totally agree. I'm not saying we divert our attention, but
but you're right. It's epidemic. It is, and it needs to be addressed. You're absolutely right. Like we can walk and chew gum at the same time, but that's something that those people need to really look into.
Right. And especially since, we hear the narrative around, it's not about access to guns or gun control. It's really about mental health, right? Gun violence is a mental health issue, but that's an excuse in some cases and not the reality, right? I mean, I'm not saying, it's totally detached from that, but why would any individual civilian need an assault weapon to begin?
An 18-year-old, a 17-year-old. Why would you need that,
I have no idea.
For me, there's a little mental happening with the parents as well. I mean, it's like a family affair here. Thank you very much. It's not just the kid.
Yeah.
It had to come from somewhere. Right?
Yeah.
Right.
Gosh, so what can we do? What should we be doing differently? What should we be doing better to educate our community? I mean, you're doing so many things, but there's so many issues to tackle. Like if we had take the chalkboard and put down like what are like the 5 things we need to like really, really focus on with our community?
So one of the things that I said to you when we were talking before we got on the call today is we need to get out of our own way, right?
Yeah.
So how many times have we, even though we fought for access to so many things, and healthcare included, now that we do, like, we deny ourselves that benefit sometimes, because now, rightly so, because of some past experiences, but sometimes because of excuses. And so I think if we, going back to what I said about, what we hope we aspire to do with our health literacy initiative, if we can really take ownership of our health and well-being and let go of some of those things in the past that create individual barriers, right, to taking advantage of healthcare resources that we do have access to because we're insured or because of what's available in the community. I think taking individual ownership could be the first step. Secondly, I think policies, right, becoming more activists and amplifying our voices and taking part of making change both at the state and local level within our communities would be another way. Collaboration, right? There's strength in numbers. Like we can't do the work that we do without collaborating with like-minded partners and other organizations that are in this fight and working to achieve health equity for not just the Black community, but for all people of color.
Everybody, right.
Right. And then, I think understanding, and this kind of goes back to health literacy, but, making sure that we get our information from a trusted resource and not necessarily buy into the misinformation and the things that I think sometimes is manufactured on purpose that we buy into or believe that also influences our behavior and decision-making about our healthcare.
And Ron, I think that also boils down to like calling the disease. Diabetes is not the sugar.
Right.
AFib is not a bad heart.
Yeah.
I mean, you know what I mean? Like, and like really educating ourselves to what our family has.
Sharing our family history, right? Talking about our family history.
And talking about putting on the kitchen table and like, but calling the real disease so people know what you're talking about.
The more we have the words, I think the more empowered we feel. My grandmother didn't talk about her breast cancer because she didn't understand half the stuff the doctor said. Right. And so the more we're able to really to educate our level of understanding, then it becomes, well, let me show you, let me teach you, let me tell you what the doctor said. And you don't mind sharing as much of what's going on, I think, when you understand more of it. But the stuff we don't understand, we don't want to talk about. We didn't understand finances. We didn't have financial literacy. So we didn't want to talk about money. It was God will provide and don't ask for nothing. Like that was, that's how we grew up.
Right now, girl, you're fine.
Right?
That's right. You got McDonald's money, right? And so now we know better and we can do better. So I think this campaign for health literacy really it has legs because it's going to encourage us to have these difficult conversations and to feel like we can ask the doctor a question or get a second opinion, or we can talk to a legislator, because it takes a lot of courage. You ladies are really courageous in the advocacy work you do, but a lot of people are still trying to figure out how to find that voice. So what advice would you give them, people who are watching, trying to figure out how to get their legs and find their voice?
I say follow your passion, first of all. And from that passion, I think you find purpose, right? And so one of the things that I was self-employed for 20 years before I stepped back into the workforce. And so one of the things that I learned when I was self-employed is, you don't get if you don't ask, and if you don't ask, you don't get. And so, like, what do you have to lose, right? So if you want to make change, you just ask for what you want. And I think that women, we can do a better job at that, right? Because, we know men ask for stuff they want all the time. Maybe they don't even earn it or deserve it, but they do. But we know that we work very hard to walk through this life every day and support the people that we love and care about and show up in the right way. But I would just say, find your passion and follow that, and make it your life's work and your mission, which is exactly what Ricky and I kind of ended up doing because of a major life crisis or health crisis.
Right. And don't you have a crisis to do that? Like, do it because you can't feel it. But I think that you do have to find something that you really believe in, but also you have to believe that you can make a change, right? You have to walk into it saying, I see, insanity all around us. in the health space. What does insanity mean? Doing the same things over and over and getting the same bad result. And so I think what I love about what you're doing is you're making things happen. You're getting results. You're seeing progress. You're seeing people getting healthy. You're seeing all those things, and you're measuring your performance. And that's what we're trying to do differently too, in terms of, you know, okay, let me see the numbers. Like, what did we change? Where are we moving the needle? How are we helping people get more mammograms or do whatever? So, or get more clinical trial participation. So I think we have to focus. When you think about what your purpose is, it has to have an end game, or
There you go.
an Oz. There's Oz over there, and we're going to get there by Friday, right? So I love that you're doing that, and, you know, trying to take command of a situation that's bleak, right? And
yes. And you know, collaborating with people like you, right? You know, when I met Ricky, it was like, you know, I knew it was like,
what can we do? What can we do?
Absolutely.
So yeah,
How can we
so
help?
she's, you know, she's going to be doing another session with us in October around probably on Metastatic Breast Cancer Day, so October 13th, and talking about triple negative, but also engaging in, you know, more Black women in clinical trial participation.
Love it.
As part of the equation to help close the gap in disparities, right?
Beautiful. It really truly is. What can people watching do to support your work and your mission?
Yeah.
So they can always donate, right? So we actually have an overarching strategy, or it's called a Campaign for Black Health Equity. The Health for Life initiative that I mentioned is part of that, one of the 6 components of the campaign. But through the campaign, it's our major initiative that we're officially launching next year, which will mark the 40th anniversary of the organization. So we had a soft launch this year. Yeah, so we're trying to make sure that we're staying around for another 40 years and really
40 years. Wow. Isn't that great? 40 years.
Incredible.
Yeah, I haven't been around here for 40 years. I've only been with this company for a year and a half, but yeah, the organization itself has been around.
What's the website? I'm just putting it in the comments.
So it's www.ca, like California abbreviated, blackhealthnetwork.org.
Got it. Okay. I thought so. I want to be sure. Okay,
Yeah,
great.
and you can follow us on social media. We're at your CBHN. Yeah, CBHN for the California Black Health Network. Yeah. And you can become a member of our organization by joining.
Talk about that. What are the benefits of membership?
Yeah, so we are offering professional development. So we have students, individuals, nonprofit organizations, and also corporations who become members of our network. So for students and individuals, we actually try to, we're starting a mentoring program. So we're pairing up students with a seasoned professional to help bring those individuals along. And we want to do our part to create a pipeline of multicultural, multidisciplinary talent who can serve communities that look like them. And that's one way that we can help start that process. We offer peer networking groups. So we have a mental health peer networking group that comes together and meet, you know, on a statewide basis. Healthy aging group.
And that's on your website. People can
It's on our website. Yeah. And we're offering professional development. We want to help provide technical assistance and capacity building for nonprofit organizations. We're creating giving circles so that we can kind of start giving out micro grants to nonprofit organizations. So we want to do our part to really uplift the community in a lot of different ways through the network.
Wow, that's great. That's great. So it's really, you guys have like,
a Wikipedia. We started a jobs board too. So people who are looking for opportunities or companies.
That's incredible.
That are looking for, you know, talent. So yeah, so we're really trying to build out the network.
You know, people don't realize how intimately, and we saw during COVID, your health is tied into your job, tied to your insurance, tied to your finances, right? And the financial toxicity of breast cancer with and without insurance is tremendous, but it has a lot to do with really making sure that people feel, you know, like they have great employment, that they have good benefits, that they have options and opportunities for preventive screening, and that when they don't have the job and the insurance, they have the resources, because the resources are out there, but they're not well publicized. I would say.
No, we recognize that too. So even with legislation talking about information and access to resources, like we've had great legislation that's been passed in the last few years. In fact, we had the California Omnibus bill, so kind of modeled after the federal Omnibus bill. And so now, because of that, women who are on Medi-Cal have expanded coverage, right? But especially for postpartum support and mental health resources and all sorts of things. And so, but there's this gap in terms of getting that information to the people in the community who need it. And so we're trying to figure out like how we can put together, you know, some sort of communications piece or, you know, get the information out there to make it make sense for people. Like, what is this about? You know, why should I care about it? How does it benefit me? And how can I get, you know, take advantage of it? So just answering those basic questions. So there's a lot of, you know, California is probably the best place, best state to be in when it comes to healthcare, just because we have been like the beacon, you know, that leads the change for what happens in the rest of the country when it comes to healthcare mostly. But we've had a lot of legislation passed over the last few years that really improve access to care. But then there's the utilization, right? But if you leave it up to, no disrespect, sometimes, you know, to the providers to share that information with patients, it's not going to happen, right?
Yeah. But you guys even have a triple negative day, right? Isn't triple negative day like a declared holiday or something, a state holiday?
We triple negative day. I'm trying to remember when that is, but no, but we have a Circle of Promise Day.
You have Circle of Promise Day, yeah. I think
so that's August the 1st.
So good, so good. Well, you got to come back. You got to come back and keep us up, you know, updated on what you're doing.
I will.
You need to be a role model for every state, girlfriend. Like, how do we do that?
Yeah, well, we could start a national network.
I love it. That's what's necessary.
Just focus on California.
Yeah, that's a great idea. Let's talk about it.
Because I think, yeah, every state can benefit from and can use what you've done as a model for how to begin to do this work in their states and really even get it across state lines into national legislation. You know, like that's where we need to go and build the strength in numbers. So that would be a phenomenal undertaking for sure.
Especially in the South Central states, you know, places like
we know where everybody's got high blood pressure. And, you know,
we see, you know, really huge disparities there.
Yeah, great.
And more and even greater degrees of racism still, like,
oh my gosh, so much implicit bias that, you know.
I think there are some, I was talking to some folks who just recently moved to Sacramento, and they said they'd moved to, I think, Alabama, to take care of her husband's father, who was ill and unfortunately passed away. But they said it was like walking into a time warp, right? It was like being back in the 60s in some ways.
The stories we hear from Alabama and Mississippi with breasties blow my mind. I'm like, you got to move, go a little bit north, even to North Carolina, to Duke or UNC or something. But gosh. Well, thank you.
Yeah, thank you for the opportunity. It was great to meet you, Dr. Mo. Always good to see you, Ricky.
Oh my goodness.
I'm looking forward to that boat ride.
Yeah, and Rhonda, let me know how I can support you. If there's that you need, if you need a clinician to do some work, panels, conversations, please let me know.
Motion come on.
Don't you worry. I will.
No, Motion come on the panel with me in October. We'll do it together.
That'd be great.
Let's do it.
Yeah.
Great.
I have to do 2 shout outs today, real quick. So our DC partner, Breast Care for Washington, they have one of their board members does a thing called Runway for the Cure, and it's this Saturday in DC.
Yes, it is.
I put the link in the chat. To give a shout out for Ramia Henderson, who does this phenomenal fashion show, and of course I have to be. She drags me to be a model, which is really fun. But we raise a lot of money for Breast Care for Washington, and then next week we're going to be at Martha's Vineyard. If you're going to be anywhere near the vineyard, come and hang out with us on August 17th. I'll also put the flyer in just go to our Facebook page and find it. And then Mo, the next week after that, the 24th, Congresswoman Robin Kelly is going to be on our show.
Awesome. All right. I'll have to tune in for that.
I know. We're so excited about that. We've been working with our office. It's going to be incredible. So stay with us. Thank you, Rhonda. We love you, Rhonda. Thank you, Breast.
Love you too. Thank you again.
So much,
right.
Rhonda.
Take care.
We hope this has been relatable and reliable and real. That's what we set out to do every single Wednesday night here on blackdoctor.org. We are thankful to our sponsors, thankful to our viewers. Yes, thankful to you, our guests, and Ricky for your lived experience and for starting Touch, the Black Breast Cancer Alliance, because this is the reason why we're here. So we're excited, and we are going to see you next Wednesday right here, 6 p.m. Eastern time, where the doctor is in.
Doctor is in. Breasty love.
Bye. Bye.
Bye.
Love.
Bye.
All right.
Bye.
So you guys, so you have to end the whole thing, right?
Yeah.
All right. See you guys. Have a good evening. Great to see you. Bye-bye.